Hello everyone, my name is Brent Muhlstein and I'm a cardiologist at Intermountain Heart Institute in Intermountain Medical Center.
I'm Dr. Jeff Anderson, a colleague of Dr. Muhlstein's, also in the cardiovascular department, involved in clinical research and clinical practice. There are a number of trials that we're excited about to hear about at American Heart Association, and Dr. Muhlstein, one of them that I'm interested in is called VITAL. The two most frequent supplements that are recommended for cardiovascular health, as you know, include vitamin D and fish oil, or we call it omega-3. And so this is the first major big trial looking at randomizing patients to placebo or vitamin D and fish oil to see if it improves cardiovascular outcomes. So I'm very interested to see the outcomes because, as you know, this has been a controversial area. I am concerned, though, that they're giving relatively low doses of each, and they're not really selecting out patients that might be deficient in these, and so I'm a little worried about whether the outcomes can be positive. So I'm interested in the other trial that maybe you can comment on, the Reduce It study that I understand has a positive outcome?
Yes, the Reduce It trial, I'm excited about it. They've already announced a little bit about it, which is using fish oil, high potency fish oil that is prescription strength, so to speak. And they say that they met the primary endpoint, which is a hard cardiovascular, major adverse cardiovascular events outcome. I'm also excited about that study because we are participating in another study using the same sort of a treatment to see whether or not in patients who have underlying coronary artery disease as diagnosed by CT coronary angiography, whether or not we can demonstrate regression of the plaque over a 2-year period. So that'll be exciting to see the outcomes and then see if we can figure out the physiology. Is it because of plaque regression or something else? Regarding the VITAL study, I'm also very interested and a little concerned about your comments about the fact that they just gave it to everybody, some of them who didn't need it, so to speak, and then they didn't give very high doses. But it does fit in with that primary prevention study with this trial that we're doing, which is called Target D, in which we actually, in a secondary prevention population of patients with known heart disease, just having had a heart attack, we are randomizing them to just standard of care versus not just giving them a certain amount of vitamin D, but targeting it, checking their levels. Are they low? If they're low, then giving them some vitamin D and checking it again to see if we make sure that they're into the therapeutic range where we target the vitamin D. And it'll be exciting to see how that goes along. But our study's still got many years before we're finished, so we're very excited to see the results of the VITAL trial.
Well, it sounds like you're doing it the right way. Getting back to Reduce It, though, it's interesting to me that we know that this product can reduce triglyceride levels, but we haven't had a triglyceride reducing agent so far that's shown improved outcomes. So this might be the first because niacin has fallen by the way. The fibrates have mixed results. So I'm really looking forward to see if this is something that we can use in patients with high triglycerides that will also improve outcomes.
I agree. And I think some mistakes that were made in previous studies, especially with the fibrates, is I guess they wanted to have the whole population to sell their drugs to because they did not target patients with high triglycerides. And so the overall studies were negative with the fibrates, but when they did a subgroup analysis of the ones that were really high in triglycerides, they were positive, but that was a subgroup analysis of an overall negative study, which is only hypothesis generating, and they didn't do another study. So now we're using another drug, fish oil, and here they did include only patients with high triglycerides. So I think they got the right target, and we'll see.
That's so important, isn't it?
It is.
Well, another trial I'm interested in is called CERT, C-A-R-T, which I think stands for something like cardiovascular inflammation reducing trial. And Dr. Ridfer out of Harvard is running this trial. And they're using low-dose methotrexate, which we usually associate with treatment of cancer or other severe inflammatory diseases like rheumatoid arthritis. But they're giving it in an effort to reduce cardiovascular outcomes. As you know, an earlier trial called CANTOS showed proof of principle at least, but it used a very expensive drug called canakinumab. So this agent, which is much less expensive in low doses, is another concept, and I'm very interested to see if they can replicate the result with another agent targeted to reduce inflammation. What do you think?
Yeah, I'm very excited about that. There's been this, inflammation, and we've done studies on it, which have documented that it's certainly associated with cardiovascular adverse outcomes. But one of the first drugs that was documented to reduce inflammation were statins. So they've always been complicated by the fact that they lower cholesterol. And so then people can say, well, yeah, it lowered CRP, but that had nothing to do with the benefit. The benefit was all lipid related. Now these studies have no effects on lipids at all. All they are is direct anti-inflammatory. And if a second one demonstrates benefit, that'll be very exciting. Also one that is perhaps cheap enough that we can give it to our patients. And it's a large enough trial, it'll document the safety if it works. And so I'm very excited about that.
Well, another class of drugs that seems to be promising for reducing cardiovascular risk that we haven't been aware of in the past are the SGLT2 inhibitors in diabetics and maybe prediabetes, I don't know. But there's another, I think the third agent, dapagliflozin, which is going to report an outcome study declare. What is your take on that?
Yeah, I'm very excited about that as well. I must confess that the idea of blocking the kidney's ability to reabsorb glucose so that you urinate out glucose as a way to treat anything and not cause urinary tract infections, I thought was sort of a silly idea, but that's why people should try things, whether I think they're silly or not, because amazingly, the two other trials have already come out, the EMPA-REG trial and the other one testing canagliflozin.
Right. The Canvas studies, right?
Canvas trial. They were resoundingly positive.
Yeah.
They had a modest effect on atherosclerotic-related events such as recurrent myocardial infarction and so forth. But unexpectedly and wonderfully, they had powerful effects on treatment and prevention of heart failure hospitalization, and heart failure-related deaths. Mm-hmm. And now we have the third one in that category. And if they have the same sort of effect, it just is going to be...
Do you think these might become a second choice for use in diabetics after metformin, of course? If we could afford them, it certainly is promising, isn't it?
Yeah, it's certainly promising. As I think about it, though, the only reason it will probably stay second of choice behind metformin is because of history. The trial that tested metformin and showed it had benefit was done 25, 30 years ago, called the United Kingdom Prevention of Diabetes Study. And it had a very modest effect that took 5 years before the benefit was shown to have any benefit. Whereas, and it never had any benefit on mortality, but these have had benefit on cardiovascular mortality, and their events occur within the first 2 years. And so my thought is, perhaps it ought to be first line. Plus it does other wonderful things. It helps you lose weight, and it helps your blood pressure go down. Just amazing things just by excreting glucose in the urine. It was unexpectedly, and just happy to see a positive study.
Continue to be some exciting new developments in cardiovascular disease and other trials as well. We're looking forward to being there at Heart Association.
Yeah, I think there will be 4 late-breaking clinical trial sessions that are there at the American Heart Association, and all of them look very exciting besides the 4 we've talked about. So come join us in Chicago in 3 weeks.